A warm welcome to all participants around the world to today's webinar, Manual Handling, the Importance of Recognizing Hazards and Implementing Safe Working Methods. We are delighted you could join us to this session, organized by the European Network of Health and Safety Professional Organizations, ENSHPO, and supported by our member organization, IOSH. My name is Mireia Rifa Fabregat. I am the ENSHPO president. I am pleased to be hosting today's session. I will be your moderator for this session, and I will be joined by three great guest speakers representing our ENSHPO network, who I will introduce to you shortly. We are bringing together perspective and good practices examples from Latvia, Ireland, and the Balkans, offering a European perspective to a challenge faced in workplaces worldwide. Today's webinar will be 1 hour long. You will hear a series of short presentations followed by a period for questions and answers. As you hear from our speakers today, please utilize the Zoom question box to ask any question, and we will answer as many as we can do at the end. First, though, for those of you new to ENSHPO, I wanted to take the opportunity to introduce the network. ENSHPO was established in 2001 under the umbrella of the European Agency of Safety and Health and Work, ENSHPO. ENSHPO engaged with decision makers and regulators at the European level, fostering cooperation between European safety and health organizations, and strive to be the leading voice of environmental, health and safety professionals in Europe to promote a safer, healthier world of work. You can find more information in our website, w.enshpo.eu. ENSHPO members are representative of EHS organizations across the continent and bring together learnings, innovations, and experience from their networks, and it's this experience we will be hearing about today. This webinar focuses on manual handling. We will discuss the hazards, how it is assessed in organizations, with examples from industry and from initiatives to encourage safe working methods in workers. So, to our speakers, I'm delighted to welcome Lubcho Koczkowski, who is an expert in PPE and lifelines, manager of the Foundation Center for Safety and Health in Bulgaria, and contact person for ILO Collaborative Center for Macedonia. Also, I would like to introduce Liva Anderson, bringing 6 years of experience in IOSH within metalworking, manufacturing, and plants, and joining us from Riga, Latvia. And I would like also to introduce Eden Nyland, the Safety, Health and Welfare Senior Manager for Technological University Dublin from our member organization, NISO. Welcome to all of you. To start, I am going to hand straight over to you, Lubcho, with his presentation titled A Comparative Analysis of Manual Lifting Regulations in the Balkan Countries. Lubcho, the floor is yours.
Thank you, Mireia, for a nice introduction. Thanks to ENSHPO and IOSH, I am able to present today what I have to share with all the participants on this very important webinar. I would like to stress that besides about introduction of myself, besides representing Bulgaria as a manager of the Foundation Center for Safety and Health, I am somehow representing +6 Balkan countries, and I will explain later how it is possible, because we are organizing a huge conference at the end of September, and you will have all the possibility to hear more about it. Also, I would like to say few words, actually to apologize myself if I make some mistakes with my English. English is not my mother tongue, so please forgive me if I'm making any mistakes. Usually, when we have face-to-face seminars, because I really appreciate the fact to communicate with participants, usually I'm trying to ask a simple question from the very beginning, and since the topic is manual handling, manual lifting of load, the question would be, what is the earliest record of an engineered solution to facilitate manual lifting? I was searching the net, and what I have found out is actually that the first written thing related to manual lifting is actually Archimedes of Syracuse, 250 years BC, 200 years BC. And here we have his famous quote, "Give me a lever long enough and a fulcrum on which to place it, and I shall move the world." Actually, if we can use this quote from a long time ago, we can find a solution for many of the problems that our workers are facing even today. Just to explain how did I came with this presentation, it's not prepared just for this webinar. I was actually researching a lot about the regulations, mostly in Balkan countries. For this seminar, I have included some of the West Europe experience, because to be honest, we always think in the Balkan countries that we are somehow very behind, that we need to change a lot. We need to actually fast forward to see what is going on in the Western world. And that's the reason why I started actually to compare regulations, regulatives, directions, conventions, starting from ILO, European Agency, OSHA from the States, Safe Work Australia, Ministry of Manpower from Singapore. And to be honest, I found a lot of interesting things, but in general, they are all coming to a very single and simple explanation. And the basis of everything is, if we go back to the history, the Convention of International Labour Organizations dated 1967, where for the first time actually it is mentioned, and there is some definition which is in the meantime somehow upgraded, but in general that's it. Manual transport of loads means any transport in which the weight of the load is wholly borne by one worker or more. Lately, it covers the lifting and putting down of loads. And for the first time, even from the very beginning, it is mentioned that we should put a special attention on the young workers. While I was continuing to see what is going on a European level, I don't think that I should explain much, a lot about it, because I'm sure that you know much more about it than I do. But the definition at the European directive from 1990 is manual handling of loads means any transporting or supporting of a load by one or more workers, including lifting, putting down, pushing, pulling, carrying or moving, etc. Which means from the very beginning, it was organized that the characteristics of the working environment were described, and organization of workstations. Yes, we cannot forget that in 2019 there were some amendments, but they are not touching any of these articles. If we add on that the research that European Agency of Occupational Safety and Health, IOSH from Bilbao, is doing, the SNR research, we'll find out that MSDs are actually the main work-related health problem, and it covers more than 60% of all work-related problems that the workers are facing. On top of it, even though the number is decreasing compared 2000 to 2015, it's a still huge number of reported musculoskeletal disorders, and we need to seriously take care about them and to face the problems and find the solutions. Then I was trying to find out how is it in Europe, in West Europe, in different countries. And every single country, every single law is actually based on the directive from 1990. But just because we have limited time for this presentation and to be much more accurate, I was just taking in consideration the rates for the age group 19 to 45 years. In France, it is 55 kilos for male workers, 25 kilos for female workers. In Spain, it's 25 kilos for male, 15 kilos for female workers. In Germany, it is 25 kilos for everyone. And here also you can see the laws in every single country and where I can find those data. So having that in mind, I was trying to find what is common to all, and actually the common thing to all West Europe countries, including the Balkan countries, which I will present later, is actually that they are all, as I mentioned, related to directive from 1990, that everyone is talking about the guidelines for risk assessment. The most important thing is training and education of workers to inform them about the possible risks. Guideline about the equipment and tool that they are using. Then it's completely different from country to country about special groups with special needs, like pregnant women, like young workers. But in general, those are the 5 things that are more or less the same as a text, not with numbers in every single country. If we continue and go down to Balkan countries, and here we have 3, 4, 7 countries from 3 of them are EU member countries, 4 of them are candidate countries. And again, we have colorful situation. Slovenia, 55 kilograms for male workers, 30 kilograms for female workers. Croatia, 25 kilograms for everyone. Serbia, 50 kilograms for male workers, 25 kilograms for female workers. Albania, 25 kilograms for male workers and 15 kilograms for female workers. Bosnia, 25 kilograms for everyone. Bulgaria, 50 kilograms for male workers and 15 kilograms for female workers. Macedonia, and I must stress, this is the old rule book, 55 kilograms for male workers and 30 kilograms for female workers. Why I'm saying old? Because while I was doing the research actually, and we had as an organization from Macedonia an online seminar to find out what is the situation in other Balkan countries, and we had those online speakers from Slovenia, Croatia, Serbia, and Bulgaria, and to find out what are the similarities and what are the differences in all countries, and how, because we were in the process of changing the legislation, the rule book for manual handling of load. What we find out that there are a lot of similarities as in Europe, but also those things that we were mostly interesting are completely different. There are specific details from country to country, and it is impossible somehow to compare them and to find a conclusion. Yes, a conclusion, it's a very important task that we must pay attention, that we must provide protection to workers, but in general, it is very difficult when comparing all those laws or regulations in Balkan countries, plus comparing with Europe, it is very difficult to find a common conclusion. What we did, I'm talking now only about Macedonia. The old rule book from 2007 is still valid till the end of this year. Starting October last year, 2022, we have a new rule book, and at the moment, both of them are on power. Both of they are valid. What is different? What is interesting? We are talking about the characteristics of the load, characteristics of the required physical effort, characteristics of the working environment, way of performing the work, individual characteristic of the employees. And we somehow have a formula for everything to compare a million of data and to find out the best possible option the best possible way how to protect the worker. Yes, there are amendments to the attachments to the regulation, where you can find not clear stated data about the maximum weight that can be carried by a single person, but it is a combination of a different action. Like if there is that person that is lifting or lowering a load, take sideways, we are decreasing the limits. If there is repeated frequent activity, we are also decreasing by percent, by formula, and having all those things in mind, we are actually coming to a position where for a male, we have from minimum 5 to maximum 25 of kilograms, and for a female, from a minimum 3 to a maximum 16 kilograms of load. Also, when we are talking about the load, we are talking about the maximum permissible masses when carrying a load. So not just lifting and lowering, but carrying. How many, what is the distance, and how often actually we are carrying that load. We are talking about when we are pulling or pushing the load. It's also different for male and for female. We are talking about permissible masses when transporting a load in a sitting position. We are talking about permissible masses during manual rolling of cylindrical loads. Of course, that we are taking care about the workers with special needs. For example, for a pregnant woman, maximum 3 kilograms. And at the end, we have exceptions to the limitation. If, for example, there is a special need that certain cargo must be handled in a short period of time, very rare, then the maximum weight is 55 kilograms for male and 30 kilograms for female. Since I'm following the time and Mirella is on the screen, I can just use the opportunity to invite all of you to visit oshwithoutborders.org page. It's about the conference that 10 organizations from 7 Balkan countries will organize together at the end of September. And one of the topic, actually, the topic is foreign main topic is foreign workers. But when we are seeing all those differences from country to country, definitely we need a platform where to start, how we can actually find a solution and between countries. When we are having workers, does it matter our workers in third country or workers from other countries that are coming to our countries, how we can protect them? That's the reason why we decided to have this title, OSH Without Workers, OSH Without Borders, with the main topic, foreign workers. If there is a need for anyone, I will be more than happy to answer any of your questions. I have here 2 contacts. One is from the foundation in Bulgaria. The other one is from my daily job in Macedonia. So it's exactly 15 minutes, Mireia. Thank you very much for the time, and I'll be more than happy to answer any questions if there are any.
Thank you very much, Lucho. You were on time, and thank you very much for the overview between manual handling between Balkan countries and Europe. It was really, really interesting. As a reminder to our audience, you can ask any questions in the question box, which will be directly to our speakers, and towards at the end, we will answer them as much as we can. And now I would like to introduce Liba. Liba is from Latvia, who sadly isn't with us today in person, but he has recorded the following presentation with the title, Manual Handling in Manufacturing. Please.
Hello, my name is Ieva Andersone, and I'm representing Association of Security Professionals in Latvia. We are an association that unites together professionals from different fields of security, including cybersecurity, physical security, fire safety, and occupational safety. I myself find my field of expertise in occupational safety and manufacturing, as this is the field in which I've worked most of my time as an occupational safety specialist. So today I would like to share with you some solutions for manual handling in manufacturing plants. So the agenda will be to look at some scenarios for handling loads manually and the consequential risks. Then I would like to look at some possible approaches to tackling non-standard manual handling, and I would like to share with you some examples from companies in Latvia. So load lifting can be divided in many different ways, but today I would like to look at two scenarios, standard and non-standard ones. The standard work processes, of course, they also impose risks on employees, but they are more known. They have probably procedures prescribed, safe systems of work included in the instructions for employees, and the risks are usually imposed by employee behavior or maybe the upkeeping of the equipment. But the ways of handling the loads are usually more known and they are more of a routine. The non-standard loads or non-standard places for lifting the loads impose even higher risk than the standard ones. And that's why I would like to look at these especially today. And the most significant risks in short term are, of course, an increase in accidents because employees are not aware of how to correctly handle a non-standard load or how to correctly work in a non-standard place for handling the load. So, of course, there's a higher risk of an accident. In long term, if these non-standard processes are not addressed, of course, there's a higher risk of musculoskeletal disorders because the load will be handled incorrectly over a longer period of time. So the three approaches that I would like to look at today for handling non-standard loads would be spotting the low-hanging fruit, adjusting conventional equipment to fit your needs, and creating at least partial solutions if there are some long-term investments awaiting. I would still encourage to, at least for now, establish some kind of a solution that improves the workplace. So the first one, the low-hanging fruit, or in other words, how I would like to call it, the perception blindness. So tackling the perception blindness and having improvements in places that maybe we oversee just because that's the way how we have done the work, and very often we just need some small twitches in the work process to improve it. This is an example from a manufacturing in a company in Latvia. This is the dock area where sometimes employees had to lift packages from a pallet on the ground, and these packages sometimes could weigh even 50 kilos. Not all the time, but sometimes. So to address this problem, the company simply put a table there where the packages could be placed on the table. This is a very simple solution, but as simple as it looks, it's a very good example of how just talking with employees, working through the work process, a simple issue can be addressed, and unnecessary risks can be got rid of them. So this is a good example of a very, very simple solution. The second one, adjusting equipment to fit your needs. This is, of course, a more difficult one because this requires larger resources and probably some technical skills. But this is also definitely worth considering if you have some non-standard parts that don't go well together with the conventional equipment that is available in the marketplace. So, for example, in this example, the company had to lift these motors, and lifting with slings was very uncomfortable for the employees. Lifting with hooks was very dangerous, and it could not be a safe way to lift these motors. So the company created a special lifting equipment to be used with the crane in order to be able to use the crane for lifting. Of course, this, as I said, requires resources, but very often it is worth it to come up with a solution that pays off in the long term. Last but not least, creating temporary solutions. This is another manufacturing company in Latvia, and they have a work process where a motor has to be lifted from this area onto a table that goes under a press, and then the motor is handled under the press. But they have an engineering solution coming way that will turn the process in a fully automatic one. But in the meantime, they have to handle the motors manually. They used to lift the motors with hands. 2 employees worked on this, but then they decided to lift them with this motor lifter and put the motor on a table that it has an adjustable height, and then it just can be rolled to the press. So this is, of course, probably slower than lifting just manually with hands, but this is a good example of maybe a temporary solution while the automatization is still being engineered and developed. So in conclusion, I would like to say that from my point of view, the main ingredient for success in all these examples and in general in approaching manual handling is definitely employee involvement, because they are the ones who are working with the loads, and the solutions definitely have to be worked from bottom to top by first talking with the employees, spotting the problematic places at the workplace, and risk assessments are definitely a good place for these conversations. So yeah, my suggestion, of course, is definitely involving employees in developing and creating these solutions for handling non-standard loads. Thank you very much for your attention, and I hope that you found at least some of these examples helpful.
Thank you very much, Liva. from regulations to practice was a useful and very practical information coming from your presentation. We thank Liva, her effort, and for giving us the opportunity to listen to her and the practical they are doing. Now, lastly, but not least, I would like to hand the microphone to Idel with her presentation, Manual Handling Challenge in the Tertiary Sector and How We Address Them. Idel, the floor is yours.
Thank you. Thank you so much. Okay, so welcome everyone. It's lovely to have the opportunity to be able to present, and my name is Idel Nyland. I am the Safety, Health and Welfare Senior Manager with Ireland's, we will say now, the largest university. We are a new university, and we've been formed by the integration of TUD and Blanchardstown and Tallaght. So now we are a single organisation, a single university with a massive population of 28,000 students. We have over 3,000 international students and over 3,000 staff members, be they academic, administrative and support staff. So the purpose of my presentation here today is really just to give a snapshot of manual handling in, you've had a comparative analysis, you've looked at 3 solutions. So now looking at it in the tertiary sector, which is the tertiary education sector, and what we have done. It's just really an example to show what's happening on the ground. So I'm going to give you a quick introduction. We look at the challenges that we have in the tertiary sector, some solutions that we have put in place, and then the future, what we hope to do in the future. Okay, so just to meet our team, we are, as part of organizational design, we have myself as the senior manager. We will have 3 specialists, we have 3 occupational health advisors, and they act as the business safety partner allocated to faculties and functions. And then we have a safety support administrator. We have, like anyone, an overall safety committee structure, and we have 5 separate campus committee structures. Now, as you can imagine, with 28,000 students, 3,000 staff, we all obviously have a lot of challenges. So the main challenges were, like, manual handling by its very definition. It's actually everyone engages in manual handling as part of your day-to-day life. The main definition, the transporting, supporting, pushing, pulling, everyone engages from the moment you wake up to the moment you go to sleep in some form of manual handling. So to complete a risk assessment of it in the workplace with over 3,000 staff, we had to make a judgment call, and we made it our policy decision about, I'd say 15 years ago, that all staff, regardless of their discipline, all staff would attend the 1-day manual handling training program. So it's developed then that you will have the actual theoretical element and you will have the practical demonstration. So everyone will be familiar then that the practical demonstration can, in some terms, be dealing with lifting a very neat little box and the correct way. Now, while the behaviors and the principles, we can apply it, it will prove difficulties if you are in a position where you're in a laboratory, a kitchen, a workshop, and you're faced then with the issue of, how do I perhaps move a fridge up the stairs or carry a piece of equipment downstairs, and just to negotiate it. It's never the easy, nice little square box. We can apply the principles. So the challenge then was to complete the risk assessment then for each of these, scenarios, whose role would involve it on a day-to-day basis. So that was one of our main challenges. We dealt with it by ensuring that everyone who commenced employment or who had a transfer would engage in the standard manual handling training. Now, after 15 years, we are ready to look further, and our policy has been updated. We now show a DVD and we engaged, I know our second speaker there spoke about, it really starts from the bottom up. We engaged with staff working in all areas so that people would see these staff, would recognize them. There was great excitement in the production of the DVD, believe it or not, and just to see that it's not just the standard box, maybe to flag to people, actually, I do move things. I am involved in manual handling. Sometimes we become complacent about it. So yes, I am involved in that. And how can I put my principles or my techniques, my safe manual handling techniques to use? Now, in this, we would then, it suggests to them that they complete a self-checklist. And in the self-checklist, then they will flag to our office that, yes, actually, we do this as part of a day-to-day basis, and we need further one-to-one risk assessment analysis and training. So I'll give a quick maybe synopsis of that DVD that we prepared. I don't know if you have that, Ben, there. So you'll see that we've looked at all the faculties, all the disciplines. So we teach, like we have so many programs from level 6 to level 10 and the national qualifications to offer. That can start running there in the background, but we look to music.
Health and safety training.
This training program is to assist raising awareness of best practice of manual handling in TU Dublin.
Manual handling. We are committed to providing a safe place of work for all. The safe handling of materials is one area we believe requires constant vigilance and training. According to medical research, 20% of back injuries are attributed to inflammation such as arthritis. 10% are due to actual back injuries and other miscellaneous causes. 70% result in degeneration of spinal discs. That's right, aging of the spinal disc material causes the most trouble and can cause extreme pain even from routine body motions. You've all heard the routine warnings about bending your knees and lifting with your legs, but do we always use that technique? Today we want to explain how the back works, so you will have enough information on how to lift anything safely. There is no magic formula. All you need is a good attitude about safety and are willing to think about safety anytime you lift anything. If you do that, it is difficult to have an injury. Anatomy of the spine. First, let us talk about the mechanics of the back. Each disc is a circular pad. This disc looks like a soft hockey puck with jelly on the inside.
Possibly,
the discs work like shock absorbers or springs.
Okay, so again, you can see in that DVD that we would have had colleagues in the Conservatory of Music and say, no, we don't engage in manual handling. We're just, we're artists, we're, deal with music. However, they will have to lift, as you see there, the harp. Now, we didn't go through the full thing, but we tried to go into every faculty and get a sample of least expected, so that to flag to everyone that we all use manual handling as part of our day-to-day activities. So that was one of the solutions that we employed. The main thing is obviously to develop the communication system and then to analyze the risk assessments that are submitted subsequent to the completion of the self checklist by the staff, so that we can ensure we follow up with the controls and ensure that they're implemented. And in that, we would use a traffic light system, very much obviously the high, the high risk ones would be dealt with immediately. But we would also engage, as the second speaker said, in the low hanging fruit, you know, so that we can do as much. Sometimes it's so much easier to spot also when you have it all mapped out. The key takeaways for us is we're always learning. We have to be led by the end user. It has to go and be driven by the people who are there working day to day. The future is self-empowering staff, and we must remember that really it's the backbone to all life, our spine, and how we really must take care of it. So the future for us in the tertiary education system and what we propose is a lot of money has been directed, you know, to training in the techniques and how we can basically empower people with knowledge. Now we're moving on a step further, and we hope to empower people in a different way. And this self-empowerment, then, we're looking to actually utilizing the money that we would have spent on training, but putting it to yoga, Pilates, and other kind of areas. So as safety, health, and welfare, sometimes, I'm not sure throughout the world if you're the same, but in particular in our area, sometimes the welfare and well-being can be neglected. So like we want to look to Pilates. So instead of when an injury happens or when we need to rehabilitate someone back to work, we therefore want to work with the body as a whole and improve people's strength, flexibility, allowing them to, you know, regain balance and motion. With yoga, it improves flexibility. You develop the core strength, improves posture and stability. If we get the body moving as best it can, we are self-empowering people from the health perspective that they are at the fittest ever. Now, we just don't want to go back to doing this once the injury is sustained. And I think it's a very interesting statistic to say that 10% are actual back injuries are aggravated perhaps at the place of work. So why not focus on the preventative end of that? We want to increase muscular endurance and increase strength of muscle tissue. Now, in that, we'll improve strength, balance, flexibility, and hopefully it'll help relieve with any kind of pain relief. We all know the benefits then, and their proven benefits, that it's not just alone flexibility, posture, the spine anatomy, and helping with that. There's many benefits. There's heart health benefits. It relaxes. We apparently would get more energy and our mood increases. Now, who doesn't want that for themselves or for their employees, that you'll have a better mood, better energy. It looks then to balance issues, chronic pain, osteopenia, the list goes on. So that is our focus. We haven't had many injuries in relation to back. Is that luck or is it good management? I suppose only time will tell now with this future pilot. We have had students and we would have to look after them, because if they are training to go into healthcare, they will need patient lifting training, and that is part of their work placement program. So that would be one element. We would have some injuries with the sports. So if you think of it, we have 150 sports and student societies. So in that, they don't get funding unless they perform the actual risk assessment. And once they do that and implement controls, we will release funding. Again, I suppose we've a long way to go. We're always learning. That's our key, always learning, but also collaborating. If someone has an idea anywhere in the world, why reinvent the wheel? Why not get together as a network of safety professionals, and not just be safety professionals, look at the welfare and well-being and see how we can best move forward and ensure that we have a healthy and happy workforce. And that's all I have to say. If you have any questions, thank you for that. Thank you for listening. And if you want to see any of our publications, please go on to my website, and that's all there.
Thank you very much, Idil. Was a wonderful, we really like, the DVD, and it's a great job. And I keep in mind one, led by the end user. I think it's, so important that they gave us the key of what to do. Now, I would like to thank you all. I would like to take this opportunity to look at any question we have received. And I have two questions here that maybe Lukchop can answer. I would like to invite Idil and Lukchop to join here with the camera.
I'm here.
Okay, thank you. Idil? Okay, thank you very much.
I can see one question here. There are big differences between maximum lifting weights between European countries. Is there any correlation between number of injuries occurring and the maximum load allowed to be lifted? I was trying during this presentation to find out, and there is an interesting map here, where actually I'm talking now only about West Europe countries, because although Balkan countries are mostly in yellow, the data is not accurate usually. But if we compare Germany, France, and Spain, we can find a link, because this is a map of the deaths from musculoskeletal diseases per million persons in 2012. Knowing that from the presentation, the maximum, the highest allowances are in France, and we have here the mostly deaths. The lowest were in Germany, and we have a lower number of deaths related to musculoskeletal disorders. Yes, you can find a link between the regulations and actually the statistics at the end, what shows. If we compare the Balkan countries, as I mentioned, it is impossible, because it's impossible, in my personal opinion, that we have a better statistics than Western Europe, and we are almost all Balkan countries in yellow on this slide. But to be honest, the reason why we started to change the regulations is just that, because we find out that the musculoskeletal disorders are increasing, and that was one way actually how to stop that and how to create much more safe environment for the workers. So to be unclear and straight straight answer to that question, yes, there is a direct link between the regulations and fatal accidents at the end.
Yeah, another question related to that I think that the audience could see is that the causation behind musculoskeletal injuries if the high percentage of is still the case in any industry. I mean, what are really, the causes behind the musculoskeletal injuries, and why is it still so high the percentage of people that injury? I think that, this is one of, you can see on the statistics, and if you go, and I can answer to the people, if you go to the IOSH website, and in the health campaigns, you could find a lot of studies and research talking about that and what is behind the musculoskeletal disorders and behind the injuries. And I would like now to ask Idil one question. Do you perform practical risk assessment?
Yes, we do. What we do is we have now developed self-checklists. So everyone will watch that DVD. It's 9 minutes. So if you're a casual person coming in and you are, even invigilating an exam, 9 minutes is not a lot of time out of your day to actually, take a few moments, look at the DVD. then you complete a self-checklist, and we perform a triage then at that point and decide, okay, do we need to follow up with the one-to-one practical risk assessment? And then our occupational health advisor team will follow up and ensure that that's completed.
Thank you very much, Idil. And another question for Lupchop. There is the same person, Michael Robinson, asked you if he said that it is, of course, a regulation is more focused on young workers, but if you don't think that older workers are more at risk and the workforce is getting older?
Of course, there is a special in every single country. I mentioned from the very beginning, because of the limited time for my presentation, I only focused on the age 19 to 45. There is a difference for young workers. Somewhere even young workers are divided in two groups, up to 16 and 16 to 18 or 19. And there is also another group plus 45. And there is a special category and special limits for those workers. And again, I will be very happy to answer with data any question. Just send me a note and I will share with all of you, because as I mentioned, I was just focusing at this point on the workers aging 19 to 45. But there, in every single country, there is a regulation for the workers above 45.
Thank you very much, Lucho. So I invite everybody, if they want to obtain more data coming from yourself, they can send to you an email. And we have here another question from Rebecca Fennelly to Idil. She said she realized education may have a different audience, but how do you find the uptake of yoga, Pilates activities across different types of people? For example, I work in a male-dominated industry, and I think it would be laughed out of the room if I suggest even just stretching the beginning of chairs.
Well, can I start that by saying, did we ever think we'd get on an airplane and that no one would smoke on it? So it's culture change. It's like, I remember years ago, unfortunately, I'm out of that bracket 19 to 45. You've really excluded me in that presentation. So therefore, I do remember a time when there was fear amongst people about flying without getting like a nicotine patch, and they even felt that they wouldn't manage it, and we're talking about every demographic there. But now there's, this is something that is accepted. It's accepted. We don't smoke in buildings in Ireland. It's accepted now. We don't vape. We are sustainability and environmental issues. Everything takes time to change, and it's very much led by your leader. It has to be led by a good leader and a culture. Yes, there will be great laughs about it. I know guys here in Ireland who sneak off and get Pilates teachers in their friend's house, but again, it's what's accepted. And if it's part of the day, that's, it will eventually, they will see the benefits, They will see the benefits.
Yes, you are right. Change of culture and benefits. See the benefits of the.
Yeah, and it's repetition. We actually have a meeting on Friday now, and the leader is bringing in a mindfulness. The last time that happened, I think the first 5 minutes, the two people beside me giggled, and it's very hard not to burst out laughing with your eyes closed when you're trying to, be serious. So I understand where you're coming from, Rebecca. Yeah, but again, listen, reach out to me separately and we can, we can chat and, just liaise and see if there's different ways, because I have also come from manufacturing, hardcore manufacturing guys, and a different kind of environment. I've practiced in private and public education. At the end of the day, people are people, and we want them to go home safe and uninjured and unharmed. And how are we going to do that? What the end justifies the means.
You are right, Idil. good answer, I think. And another half from question from Lupcho. There's Michael said that the slide you have show deaths from musculoskeletal disorders, but are deaths or really, because he said that usually are back injuries, pull muscles, but not really deaths. Maybe there was a confusion.
Thanks, Mireia. It's not a confusion. I can share again the same slide. It's from the internet, and it says deaths from musculoskeletal diseases per million persons in 2012, and starts from 0 to maximum 104 on 1 million, which is very low percentage, but still there are deaths caused by musculoskeletal diseases. I mean,
yeah.
I don't want to start explaining. This is not mine. I'm just using it as a source, and it says that I would like to trust them.
Yes. No, I was clear. I think that maybe this person confused and not see really what was pointed on the slide. And just to finalize, I would like to ask you, Lucho, we have here you. What's the reasons of changing the regulation in Macedonia? Could you answer me that?
Thanks, Mireia, for the question. Actually, I've tried to explain that a little bit earlier. It's just the fact that the number of musculoskeletal disorders, the reported injuries are increasing, and actually we find out even without special research that the cause is actually the high limit of allowed weight to be lifted by a worker. It was 55 kilos in the past, and we decided that maybe it's proper time to start decreasing that, and to see in a few years will the number will be changed, and was that a good call or not, if we successfully actually improve the working conditions for the workers. It's too early to talk about it, but comparing data from other countries, comparing the data mostly at the moment how it was in Germany, and how some Balkan countries actually just took the numbers from Germany for both male and female. We hope that we will decrease the number of musculoskeletal disorders in the future in Macedonia. That was the main reason.
Thank you very much. We have no more time. I would like to say so many thanks to Ida, Lupcho, and Liva for being here today. Thank you very much for the audience and for your participation and to be here. Shortly, the webinar will be uploaded to the website of ENSHPO and IOSH, so please don't forget to visit and be updated in our website to our next webinar. Thank you very much. I hope to see you soon.